Welcome to Smart PT. My name is Jonathan Reimer. Today we're going to be talking about plantar foot pain, how to treat it from a manual therapy perspective. The first thing to consider when you're diagnosing plantar foot pain is your differential diagnosis. You'll get a lot of prescriptions from physicians or referrals from other therapists that indicate plantar fasciitis as the diagnosis. It's obvious, it's the most typical one that they diagnose anytime there's plantar foot discomfort. In my experience, I more often see that the tibialis posterior muscle is producing that plantar foot pain. As you can see on the anatomy slide, the tibialis posterior runs under the medial malleolus and then inserts broadly across the plantar foot. And you can see its close proximity to the plantar fascia. The tibialis posterior muscle is the most active arch muscle. It's working at all phases of gait, both concentrically and eccentrically. So in my experience, it's a much more obvious source of plantar foot pain. That being said, plantar fasciitis and tibialis posterior, possibly tibialis anterior, they're all irritated by the same kinds of issues. Generally, an arch collapse type problem, where the foot is splaying and the arch is falling, tends to stress these tissues. So that's one area that, in terms of treatment, that you need to generally address. Whether you do that through taping or orthotics is your choice, but I highly recommend you look at support of the medial longitudinal arch. The other thing I'll tend to look at as a manual therapist is the tension on the calf. If there's high degree of tension on the calf, that'll restrict movement at the ankle and force more pressure and splaying through the forefoot and midfoot. One other thing as a manual therapist that I tend to look closely at is the mobility of the talocrural and subtalar joints. Those joints produce most of the movement in the foot in both plantar and dorsiflexion and inversion and eversion. So I'll take a close look at mobility because if you're getting restricted movement through those joints or excessive movement through those joints, you will tend to stress the mid and forefoot, putting extra load on tibialis posterior, tibialis anterior, plantar fascia. So definitely mobilizing the soft tissue of the calf with a solid stretching program, as well as mobilizing the joints, the articular structures of the subtalar and talocrural joints. And then typically what we're looking at is supporting the potentially hypermobile midfoot and forefoot joints. So that's my take on diagnosis and treatment of plantar foot pain.